The first report of AIDS-related illness was in June of 1981. In those early years, it was invariably fatal, and so patients often only had a few months to live. My name is Dr. Brian Woodfall. I'm the Global Head of Development for Infectious Disease at Johnson & Johnson. My job involves the research and development of new therapeutic approaches for infectious disease, like HIV. I attended medical school in Canada. I took a year to do temporary assignments, filling in for HIV doctors, and got deeply into the care of those individual patients. I have an incredible passion for this disease, for the communities, and for the vulnerable people that have really been affected. And that's how I met Tico.
My name is Tico Kerr. I'm 68 years of age. When I heard I was HIV positive, I thought it was pretty much the end of my life. I was on a revolving door of medications from '86 to 2005. Probably about 30 or 40 medications over the course of that time. But in 2005, my health dropped completely. I'd lost 30 pounds. I looked like hell. They started throwing everything they had at me, but it still wasn't working. I probably had about 6 to 12 months to live. And my diary of my life became reflected in my work.
At Johnson & Johnson, we had 2 new treatments that were in development that were specifically designed to be able to treat drug-resistant virus. And what we had learned is that if you combined multiple new drugs together, that they would have a greater impact than adding them one at a time.
My name is Dr. Josh DeWitt. I'm the principal investigator at Spectrum Health for our HIV clinical trials in Vancouver, meaning I'm responsible for who gets selected. We follow them closely, and I'm in the lucky position to see the results. Tico was very close to dying. In fact, Tico spent many months in the hospital when these new treatments became available. And Tico was one of that cohort to try the 2 new drugs.
We were given the drugs. Within a week, the amount of virus in my system had dropped by 90% with the new medications. All of a sudden, the anger turned to gratitude.
Work that we're doing now in HIV is looking at new approaches to therapies, where instead of taking something every day, perhaps you get a treatment like an injection to give new treatment options to the various populations that will require lifelong therapy.
There's no words to describe when you get your life back.
For patients like Tico to now be surviving, thriving, and healthy so many years later is nothing short of a miracle.